Hi, my name is Seth Deja, and I'm the pediatric dentist at Pediatric Dental Specialist of Lafayette. My goal and job here is to get to know you and your family. I'm here to educate you about all the different developmental milestones that your child will go through, as well as if any treatment is needed, make sure that I'm discussing the risk and benefits, as well as alternatives, so that we can safely and effectively meet your needs. The difference between a pediatric dentist and a general dentist is after dental school, the pediatric dentist goes to an additional 2 to 3 year residency program where they learn specifically to take care of pediatric patients and those with special health care needs. So they're informed about growth and development, orthodontics, and any other indications that might be needed for a patient that would not typically be seen in a general dentist office. My approach to taking care of a pediatric patient is a little bit different than a general dentist. So we look at different things like the age of the patient, the dental age of the patient, when the teeth may exfoliate or be lost, and kind of make a decision about what works best for that patient. So the main thing is a personalized and individual plan for each child. So not everyone can be treated the same because they all bring different things to the office that may affect how they handle treatment. If you're a parent and you're looking for a pediatric dentist, especially someone who's going to look at the patient as a whole, look at all the things that they may bring to the office from past experiences and lifestyle, this is the office for you because we pride ourselves on giving each patient individualized and personalized plan because we know that not every child is different and each one has just a different ability and comfort level whenever they're in an office setting. Some of the differences between our office and others is that we knew that whenever people came in, that they're already a little bit nervous. So we wanted them to come in and feel comfortable and feel like they're walking into our home. So everyone who comes to our office, they do get their own private room versus the kind of traditional open plan so that we can have private conversations and discuss what's really important with the family and they don't feel like anyone is listening or there's any pressure on them. I would say the biggest difference with our office is we're a small office and we do that on purpose. It's so that we can get to know the patients, but most importantly, so that the families can get to know us. Every patient and family will have their own private room so that they don't have to worry about having discussions or worrying about what's going on around them. So their child can focus, watch TV, and ask the dentist or the staff any questions that they might have and know that all the attention is on them. I would say the patients that benefit the most from seeing a pediatric dentist are one, the very young patients, because that allows us to establish, good oral hygiene habits from the very beginning. Also, a pediatric dentist specializes in treating those with special healthcare needs. So if you have any dental questions, a pediatric dentist is really one of the first places that you should go so that they can start walking you through the different options and any of the findings that you may have seen at home. The way that I partner with families is that I always want the parents to know that the ultimate decision is theirs. We're there to guide them. So that goes by motivational interviewing so that we can see what changes, if any, that need to happen can actually be done in the home as far as shared decision making. So I want families to know that whenever they come in, the decision is not mine, but it's so that we can make the decision together on what we believe is the best for their child. One of the biggest things that we hear in this office whenever patients switch from a general dentist or even another office is that we have the time to listen and take care of them. We have extended appointment times whether we need it or not because we want to make sure that everyone is comfortable from the second that they come in to the second that they leave, whether they're going to come back for routine cleaning or we have treatment. We want them to know that everything that's going on in their life and all of their abilities to make any changes that we might need, all of those things are listened to so that they're not given just a routine plan. At the first visit at our office, I think you're going to experience something different. We are a small office and we keep it that way on purpose because we're a family as well and we knew what we would want out of the dental experience. So not only are we going to get to know you and your family, but you're going to get to know us. You're going to get to know me, the pediatric dentist. You'll get to know our front desk as well as our staff so that every time that you come, you'll be familiar with the room that you were in and the staff and myself that helped you all along the way.